This is our presentation for our capstone research project. We researched how prevalent Pilates is in physical therapy and occupational therapy outpatient clinics. For our background information, we looked into other research articles to understand Pilates and the benefits of practicing Pilates in rehabilitation clinics. Pilates is characterized by focusing on strengthening the core to improve posture, strength, and flexibility. It was developed in the early 1900s by Joseph Pilates. Not too long ago, Pilates found its way into rehabilitation as research studies demonstrated the effectiveness in reducing pain in clients as well as improving their strength and function. While we researched the connection with Pilates and therapy, we noticed that there is a lack of information on how prevalent Pilates is in physical and occupational therapy practices. Since there is little to no data on how prevalent Pilates is in physical and occupational therapy clinics, the purpose of this project was to determine if Pilates is used and/or effective in outpatient physical and occupational therapy clinics in Ohio and its surrounding regions. We also wanted to evaluate common diagnoses that use Pilates for treatment if offered by the therapist.
An email survey was created to find out if physical therapist assistants, and/or occupational therapists utilize Pilates in their practice. The survey was created with REDCap, and the results were obtained through REDCap software. The survey was sent to the emails of physical therapist assistants, and occupational therapists, and these emails were obtained through the University of Cincinnati's Occupational Therapy and Physical Therapy Clinical Education databases, as well as UC's Physical Therapy Alumni database. After the initial survey was sent, weekly reminders were sent as a follow-up. The survey was sent to a total of 365 email addresses. Of these, we received 49 respondents, 1 occupational therapist, 44 physical therapists, and 4 physical therapist assistants. Of the respondents, 12 utilized Pilates in their clinical practice. Only 2 of these 12, however, were certified Pilates instructors. The diagnoses listed from most to least common were low back pain, post-orthopedic surgery, sports rehabilitation, neurorehabilitation, scoliosis, and general strengthening. The chart on the left shows the type of Pilates that these respondents implemented. 9 used a reformer, 6 used mat-based Pilates, 2 used chair-based, and 1 used a Pilates Cadillac reformer. The chart on the right shows what the respondents answered were barriers to implementing Pilates in their practice. Many of the barriers included lack of equipment, lack of training, cost, time, and lack of evidence.
Of the 49 therapists who responded, almost 25% of the clinicians use Pilates in their clinical practice. Some of the strengths of our projects were the survey design, our REDCap, how we utilized the survey. Some of the weaknesses that we had was that only 1 occupational therapist responded, which obviously we would want to have more than that to get more of a variety of responses. We also had limited email distribution. We didn't have very many emails that we had access to send the survey to. Of the 49 therapists who actually participated in the survey, 12 of those use Pilates in their clinical setting. Pilates utilizing the reformer was the most common. Respondents had limited training in Pilates. Only 2 respondents were certified Pilates instructors. So the greatest barriers for implementing Pilates were equipment and the training to actually understand how to use Pilates. More information of how Pilates is used in the clinical setting would be beneficial for this project. For the future direction of this project, the survey will be sent to the email distribution list from OPTA, OOTA, and the UCOT Clinical Education Database so that we can get a wider variety of responses and understand how Pilates, if at all, is used in the physical and occupational therapy settings.